And I have an honor to ask Denis Horgan on stage to give his speech. And from my personal point of view, I'm very happy that he managed to join us today.
Thank you so much. It's my honor to be here today, I should say. And I'm delighted to be here to speak about how we can bring personalized medicine or personalized diagnostics into healthcare systems. And it's an honor because, I mean, this forum has been organized by the Ministry of Economy as well as in collaboration with the Ministry of Health, which is a key issue because a lot of the barriers is around how can we bring innovation into healthcare systems is around the reimbursement issue. But not only the reimbursement issue, it's also about how do we allocate resources in society. Because often personalized medicine is very much focused around the therapeutics. I mean, and it often focuses around how much this therapeutic costs. But often the story around personalized medicine is around early diagnosis and how do we identify patients earlier. And this has been a key focus of what I want to speak about now. I mean, when we look at policy, so as a conflict of interest, I'm not a medical, a doctor, an oncologist, I'm a lawyer. So I will give a policy and legislative perspective on how we focus and structure it at a European level, taking account the issues in terms of at a national level as well. And to frame the discussion, one must have a definition in terms of how we frame personalized medicine or precision medicine oncology at a European level. And we came up with a definition in 2016, which has been enshrined in the European Council conclusions on personalized medicine, which was supported by all member states. And this is the definition that we have framed it. And I mean, it's a standard definition, but it really puts the focus also on the patient. How do we keep the person in personalized medicine? Because often when we talk about personalized medicine, we talk about, often it gets confusion around smaller patient populations. So then it's very similar to a rare disease because you have smaller patient populations. But personalized medicine is an approach to healthcare. How do we identify patients earlier with advanced molecular diagnostics? And then how do we follow those patients through the treatment pathway in terms of patient monitoring? And then what services can be developed to bring this type of healthcare into the healthcare systems. So this is a definition that has provided the structure around it. And from this definition, we have different legislative frameworks that have supported this. Now, the Council conclusions is like a policy framework. In America, they had the Precision Medicine Initiative, and they had the Moonshot. What we propose at a European level, not to go to the moon, but keep it on the ground, to have a ground shot. And what are the frameworks to support bringing this type of innovation into healthcare systems? Now, Europe developed a lot of legislative frameworks. One was a legislative framework on clinical trials regulation. Then you had another regulation on general data protection regulation. And now you had most recently on in vitro diagnostics. Now you have another legislative framework on pharmaceutical legislation. And now you have another one on European health data space. So a lot of different legislations that are going on. But often with these legislations, there's a lack of dialogue between the legislative instruments. So in terms of the EU clinical trials regulation, which was revised, it took 10 years to revise, but academic clinical trials have dropped substantially in Europe. And the reason was that because it was more administrative burden to undertake clinical trials. When we look at the general data protection regulation, it was well-intentioned, a piece of legislation, but then the implementation of the said legislation into practice has disrupted how data can be shared between different healthcare actors. And this has led to a consequence that now we have the European health data space, which I will come on to. One of the initiatives that we came up with was the 1 million genome initiative. How do you sequence 1 million genomes? But then again, it's not about sequencing 1 million genomes because that can be done easily. You can sequence a genome now for less than $1,000. But the question is all the data that will derive from this and the subsequent services that need to be within a healthcare system to empower that data in terms of treating, diagnosing, and implementing different types of healthcare interventions. And the key issue here is that often laws are like sausages. It's better not to see them being made. And this how often is an issue in the legislative issues, because this forum, I mean, I was talking to different patient representatives as well earlier, the question is, often there's a disconnect between the policies that are developed at a member state level or centralized level and those that are implemented in practice. And the question is, how can there be more of a connection between what healthcare systems need and what the laws are there to support them? If you look at the General Data Protection Regulation again, this General Data Protection Regulation was more about limiting liability of how data could be misused. In fact, it should have been how can we empower data for different uses. And this comes into the issue is how do we use current treatments and diagnostics better? Excuse me. How cancer changes with time. So you need the value of diagnostic information, not only in terms of treating the patient at that one time, but how do we modify the different treatments to improve that patient's life cycle? How do we implement these strategies in healthcare? And how do we advance early detection and ultimately prevention? And a lot of these issues come into the realm of policy and legislation, because often you need to plan 10 years in advance in terms of these type of interventions. And then how do you set up the healthcare systems to be ready to do that? And often the issue in terms of personalized medicine, as I mentioned, comes into the issue of, in terms of the access issue, that these therapies are not available in different countries. And of course, this is an issue. I mean, because EMA centralizes the authorization of different medicines, but different patients cannot get access to different treatments in different countries at a certain stage. This is one aspect of, in terms of the issues around personalized medicine, but that's only half the story. Because the major story in personalized medicine is a number of biomarkers that are being developed. And there's a substantial more number of biomarkers that are being developed now to identify different targets. But then the question is, how are healthcare systems set up to treat patients at an earlier stage? and the issue there is, I mean, what resources need to be put in place so that labs have the necessary infrastructure, there's enough pathologists, we can set up molecular tumor boards, and again, how can molecular tumor boards be set up between different countries? So then again, it goes back to this data issue, how data is shared, and then the issue around the value of diagnostic information. How can we reimburse different diagnostics in the healthcare systems? Because a lot of the discussion in the healthcare systems is around medicines, and often the medicines can get reimbursed, but the diagnostics are not reimbursed. So the question is, how do we allocate resources in society? And this is an important issue in terms of how do we identify the steps. Because there's a large variation in the use of medicines both between and within groups of countries. And you can see lung cancer medicines. And then you have different types of therapies here, as well as colorectal cancer. And you can see different countries have prioritized different types of treatments in certain countries. And the question is, why is that? Why is certain resources allocated in certain countries in certain ways and not in another way, in another country? So the question is, why is that in different types of healthcare systems? The same in terms of immunotherapy. Of course, depending on the GDP of the country, there's less uptake of immunotherapies. But the question is, there's a large variation in terms of which immunotherapies are being utilized and the volume of this. And the question is, why is there difference in terms of why certain countries do this? The same when we come to colorectal cancer. There's different primary care, outpatient care, A&E, inpatient care medicines. But then you can see the different resource allocation in terms of treating a patient in different countries. And certain countries have a high expenditure on inpatient care, but less on outpatient care. And the question is, the different healthcare systems are organized in different ways, but maybe they're not set up in terms of identifying patients, how we can treat them at an earlier stage, so improving their quality of life. So this is the key question. It's not about access to medicines, which is a crucial point, but the issue is how do we identify patients at an earlier stage so that to treat them. But then the question is, how do we allocate respective resources